Hello, everyone, and welcome to the Canadian Centre for Caregiving Excellence's webinar, A National Caregiving Strategy for Canada. So, like me, I'm sure you're all eager to get started and learn about the new strategy. We'll begin in a few short seconds. We'll just let a few more people join the webinar. And as people are joining, I just wanted to mention that I'm stepping in today for my friend and colleague and fellow caregiver, Brenda Blay. And Brenda, unfortunately, has a serious back injury and is unable to join today as the moderator. But so I just wanted to mention that we all wish her well, and I hope she's feeling better soon. Thank you for all the heart emojis. I'll tell Brenda. It's a typical caregiver injury, too. Just wait one more minute. I know people are still coming in. Okay, I think we can begin. Let's get started and welcome to today's webinar. Before we begin, I want to acknowledge that the Office of the Canadian Centre for Caregiving Excellence is located in Toronto, Toronto, on the traditional territory of the Anishinaabe, including the Mississauga of the Credit, the Haudenosaunee, and Huron-Wendat. This land has been governed by the dish with one spoon wampum belt for 1,000 years, and in recent times by the Williams Treaty and Treaty 13. All people living in Canada are treaty people. We are all part of a relationship based on respect, cooperation, partnership, and recognition of Indigenous rights. And the CCCE is committed to equity for the Indigenous caregivers and care providers and to learning from and working with Indigenous communities. And you can read more about that work on the CCE website. Personally, I'm located in Ottawa, which is the unceded territory of the Algonquin people. So, a few housekeeping notes. And you can turn on the English captioning by clicking the CC button at the bottom of your screen, or you can view French captioning via the URL in the chat. So you'll see that right there in the chat. Which is in your bottom toolbar there. There's a number one, red number one beside it. If you would prefer to listen to a French audio translation of this webinar, click the interpretation button at the bottom of your screen. The information on where to find that is at the bottom of your screen as well. And sometimes you have to scroll over the bottom of your screen for those icons to pop up. We will be taking questions near the end of the webinar, but feel free to enter your questions at any time in the Q&A box, which is accessible at the bottom of your screen. And I'm your moderator, Donna Thompson, And for those of you who don't know me, I'm a longtime friend and supporter of the center. I serve as an advisory member, a member of the advisory council since 2022, the inception of the center. And I was also an inaugural member of Caregivers Can Network, and more recently, a member of the National Care Champions Table. I'm all in. I love this organization, and I feel so hopeful that we're going to get a national strategy for caregivers in Canada. And so, like many of you, I am a caregiver in my DNA. I started my caregiving at age 16 when my dad had 3 strokes. And then in 1988, our son Nicholas was born with very severe cerebral palsy and medical complexity. And then later, more recently, I helped care for my mom with my sister, who died in 2018 at the age of 96 after living with dementia for about the last 10 years of her life. So I'm so excited to hear about this strategy and reflect with you on ways that our lives can be transformed by getting more visibility, more help, more real practical help in our lives. So, um, and caregiving is hard, it's challenging, but with more support, we know it's possible. And we have the right to care for the people we love. We want to care for them, but we don't want to collapse under the weight of burden of care that we're carrying more or less alone. Um, Today, we're going to, as I said, learn about what's in the strategy and how it's going to help us. And it does include tangible and practical policy solutions uh, that are really going to have an impact on our lives. And those policy solutions and all of the elements of the strategy are based on thousands of conversations and consultations that the strong and mighty team at CCCE has held coast to coast to coast in Canada. So, um, during today's webinar, we're going to, I'll just bring you through a little bit of an agenda. You're going to hear from CCCE's Executive Director, Liv Mendelson, and James Gennaro, who's the Director of Policy and Government Relations. And they'll walk us through how they developed the strategy and, most important, the pillars of the strategy that show a better way forward. And we'll also hear from caregivers Bhavani Patel, who cared for her father through his dementia diagnosis, and Jordan Wiley, a direct support professional and member of CCCE's DSP Fellowship. And they're going to talk about their experiences and how they feel the recommendations in the strategy can make their lives better. So, without further ado, I'd like to now turn it over to Bhavani to ground us in her experience as a caregiver. Bhavani.
Thank you, Donna. Thank you to everyone at the center for including me in this conversation today. And congratulations on the launch of the strategy. So as Donna mentioned, my name is Bhavani, and I was a caregiver to my father from when he was diagnosed with dementia back in 2014 until he passed. And the caregiving journey was one of um, great gratitude and complexities at the same time. I was a working caregiver, excelling in my career, and as he declined and needed more supports, I chose to leave my job because there were lack of flexible options and solutions to balance both options. So I did leave my job, cared for my father along with my family at home. And we were very lucky enough to have amazing nurses and doctors and a whole interprofessional team that I really learned a lot of skills from and how to care for him and give him a very clean, comfortable, dignified life. There are challenges in this role, and one of them is receiving emotional supports and finding that community service that provides these type of supports. Lack of flexible work options that kind of stalled my career as I now try to re-enter the workforce and re-engage. And then coordination of home care and proactive communication can sometimes be challenging. And so I really love what the strategy is laying out because it shines a light on the caregivers and their role in our healthcare system overall and the supports that would really benefit them. It encourages our entire nation to think differently, to do differently, to foster pride, to foster compassion, which I think is really important to the culture of our nation as well. And it opened conversations to update existing policies that may be outdated and also to create new ones that reflect today's society and today's caregiving population. So thank you again for having me.
Thank you so much for sharing your story, Bhavani. And, listening to you, I see so many hearts going up on the screen, and my heart is full too. And I'm really, really glad that we started this webinar with a caregiver story because that is the heart of everything that we do. We have this shared experience that is becoming ever more complex as the number of caregivers grow. Um, and more of us are caregivers, and our loved ones are living longer, living sicker. Healthcare at home is becoming ever more complex. This is not a sustainable solution, and it's not acceptable as a reality of our lived lives that we collapse under the burden of care for those we love. So, thank you so much for sharing your story, Bhavani. And now, I'd like to hand it to Jordan, who's going to give us the opportunity to hear about his reflections on being a frontline paid healthcare provider and what the policy proposals in the strategy mean to him and everyone else who's working in healthcare today, our essential partners in care.
Oh,
Jordan.
thank you, Donna. Hello, everybody. My name is Jordan, and I am a member of the CAMH Direct Support Professionals Fellowship Program. And yeah, I have experience both as a unpaid caregiver and a paid care provider. Prior to going to school, I took care of my grandmother when she retired and her health started to decline a bit. So she moved in with me and my mom. And this strategy kind of explains that a lot of us are caregivers and we really don't even know that we are caregivers. So I picked up a lot of responsibilities with helping my grandmother. Um, and my first exposure to um, the sector and paid providers is the people who, because at first we were great, everything was wonderful, but then things started to become very difficult. So we got help three days a week from a care provider. She came to our home and she helped my grandma with things that me and my mom just couldn't help her with at the time. So a couple of years later, I went to school and I became a healthcare aide and I started working at my local hospital. And from there, I realized how difficult it is, not only for myself, I'm just one voice, I'm just one care provider, but I could realize how difficult this system is in general. So currently, I live and work in Halifax, Nova Scotia, as a care provider full time. And I help seniors, I help veterans, I work in the disability support sector. And this strategy really I'm so thankful for this strategy and having the opportunity to be here, and because it's given me a moment to really think about what I'm doing, the work I'm doing, this sector that I'm in, and how many challenges I think we all face every day doing the work that a lot of us really just love, but is, I would say, not really appreciated as much, or um, Canada as a whole doesn't really invest in the work that we do. So I'm just excited to be here and to learn more and just to be a part of this strategy moving forward.
Thank you so much, Jordan, for sharing your story and your reflections. You know, what struck me as I was listening to you just is how many of our essential care partners, the people who are paid to come into our house and help us look after our loved ones, that those people like you, Jordan, are doing double duty care. You're caring professionally, but you're also caring for your grandmother and probably for your mom too. Um, we care for multiple people, and we just can't do it alone. And so one of the great big elements of power, I think, for me, at the CCCE and in the strategy is that we pair support for family caregivers with support and better support, decent wages for our paid providers. And we need to be working together, hand in hand every day and supporting each other as one big wraparound team. So, so pleased that you know, you've been able to tell us your story, and that it tells us so many things about what we're just going to hear in the strategy that are going to, I think, transform our lives. And I say that without being, uh, you know, in a dream world. I really think that this national strategy has the potential, if enacted, to transform our country and our lives and make Canada the best place in the world to give care, um, and it's sustainable care, and also create a care economy and support our economy by claiming caregiving as infrastructure. So now it's time to get to the meat of this webinar, which is to dive into the strategy itself. And right now, I know that Liv Mendelson and James Gennaro are going to tag team to tell us all about the strategy and do a deep dive into the content. So over to you, and thank you so much.
Thank you, Donna, and thank you, Bobany and Jordan. I'm Liv. I'm the executive director here at the center. I'm going to tell you a little bit about the center, but I just want to start by noting the resonance in so many of the stories we heard today from the three of you, and the stories we heard from literally thousands of caregivers across the country. I have my own caregiving story. I'm a caregiver. I've been a caregiver since I was a little girl, caring for my grandmother who lived with us. I cared for my mother through her cancer and palliative care journey, and I'm caring for my wonderful father as he ages. And I know that so many of us on this call know that we are caregivers and we are going to be care recipients too. So as Donna said, it really is reciprocal, and it's something that touches every Canadian family. So, just to share with you a little bit about the Canadian Centre for Caregiving Excellence, we are an initiative of the Azrieli Foundation, and Donna really said our vision in a nutshell is of Canada being the best place in the world to give and receive care. What that looks like for us is, quality care where caregiving is valued, caregivers are supported, and people accessing care are central to policies and practices. Our vision really is about supporting and empowering family and friend caregivers and care providers, advancing the knowledge and capacity of the caregiving field, and advocating for effective and visionary social policy, which all of you have helped us to develop, which we're going to get into today, with a disability-informed approach. So we try to meet this mission, this ambitious mission, in three ways. We are a funder, we're a convener, and we're an advocacy organization. And all of those roles overlap. And you'll hear today about all of the advocacy that we've been doing and that we are doing with you. Grace, if you can advance to the next slide. We're going to talk about the state of care in Canada, what we know. So next slide, Grace. Thank you. So we know that 1 in 4 Canadians is a caregiver today, and half of us will be in our lifetime. That's about a little more than 8 million caregivers in Canada. And we know that the state of care for caregivers and care providers and people who access care is really untenable. We're facing a care crisis, and we can't find our way out of this crisis without significant policy attention and policy reform. Caregivers are, as so many of you know on this call, you're living it, are the unseen backbone of our healthcare system. For every hour of care delivered in the healthcare system, caregivers are giving 3 hours of unpaid care. Without us, Canada's health and social systems would collapse, period. Caregiving is also beautiful and meaningful and rewarding and reciprocal. And I think that's important to really underscore. We know that people with disabilities give care, people who are aging give care. This is all of us. All of us are caring for each other, and we need better systems to support that work. We also know that caregiving is invaluable to the Canadian economy. The annual economic value of this unpaid care, and what Donna was starting to talk about with the care economy and infrastructure, the value is $97.1 billion. So we know that caregivers, Grace, you can advance to the next slide, can't continue with the status quo. You have all told us loud and clear in many, many consultations and in our caregiving survey, in our national caregiving survey, that you are overwhelmed. Half of us are dealing with significant mental and physical health impacts of unsupported care, and half of caregivers are facing financial stress due to costs of care. And waiting lists for care and for respite are endless. People who access care, our loved ones, need better supports to thrive and live with dignity. We know that the number one concern for caregivers always is the person they're caring for. And so many caregivers have told us that there is no caregiving strategy without those critical supports for the people who need care. We also know, as Jordan alluded to, that our frontline healthcare professionals are PSWs, personal support workers, disability support professionals, are undervalued and underpaid and dealing with very difficult working conditions. And we know from our survey that 80% of you have considered leaving the field in the last year. And that is startling because we know as caregivers that it's very difficult to find in many parts of this country a care provider, cannot find one for love or money. There are tremendous shortages in this sector. So there is a lot of work to be done there too. And we know that there is an opportunity for absolutely bold and urgent leadership here. And we believe that the time is now. And I'm going to turn it over to James to talk a little bit about the moment that is now. And Grace, you can move to the next slide. Thank you.
Thank you very much, Liv. So, folks, it's a pleasure to be here today. I'm James Gennaro. I'm the Director of Policy and Government Relations here at CCCE, in addition to being a caregiver all my life as well, various ways on and off, great-grandparents, grandparents, most presently, in particular for my beloved grandmother, for whom I provide a variety of different kinds of care. So it is a privilege to be able to do this work with my head and my heart at the same time. and get to live my values in this way. And in that same vein, it was quite a day for us and anybody all of us in the CARE movement back in April of 2014, excuse me, 2024, not 2014. My God, where did that decade go? April 2024, when the federal budget included for the first time ever a commitment to develop a national caregiving strategy. This is the outcome of the work of a lot of people, including those of us right on the front lines, beating down the doors, knocking on those doors of elected officials to get this commitment to develop a national caregiving strategy. That was in budget 2024. Prior to that, we had already started down our process, which Liv will point to in just a moment, around creating our own national caregiving strategy, because we felt that it was one thing to be advocating for the government to develop a strategy, but to be credible, to be serious, to answer their questions, we felt like we had to have some concrete answers about what should be included in that strategy. And today, I'm very thrilled to say that all these months later, we do now have our national caregiving strategy published and out and ready to go. We'll be talking about it in great detail in a few moments. And we are in a position now to essentially hand it over to the government as a way for them to fulfill this budget 2024 commitment. Back to you, I think, Liv.
So we're going to share, next slide. Thank you, Grace. We're going to share a little bit about, oh, I'm sorry, James. It is still you.
Oh, indeed it is. So we've decided in consultation with a variety of different players in the space that we would start with the federal government. That the federal government is the only government in Canada uniquely positioned to touch millions of caregivers all at once. And the federal government has a unique power to set the table. Once the feds start talking about an issue in concrete ways and start implementing public policy to address these issues, it touches millions of people all at once, and it also tends to start the conversations at the provincial and territorial orders of government. Because we know, we both know as practitioners in this space, but also in talking to caregivers every day and care providers, that a lot of this work does live at the provincial order of government. To the provincial governments in Canada and territorial governments in Canada, I'll say, we're coming for you next. We have started with the federal government, and we are proud to present this work directly targeted at our friends in Ottawa at the federal order of government. We're also living through a unique electoral moment. I don't need to tell you that we likely have a federal election coming down the pipe in a few weeks, months, whatever it might be. And the great thing about the timing that we're living in right now is that there is still a sitting government while we are thinking about a federal election. So it is now a time to do two things at once: to advocate for government to pick up the strategy and move with it, but also to turn to the potential candidates for highest office in our great country to pick up this issue and do something about it during an election campaign and afterwards. More on that closer to the end of our presentation. Now, Liv, I think it is back to you.
Great. We are truly tag teaming. So Grace, if you can advance the slide, thank you. As we approach this work, we did it with a lot of thought and a lot of intention. And I think it's important both at the outset and at every step along this process that we were reflective about the ways in which we worked on this strategy and the ways in which we engaged caregivers, care providers, people who access care, as well as sector leaders, policymakers. So we'll just take you through the thinking and the values behind this work. First and foremost, co-design. This is your strategy. The ideas that you will see came directly from consultations and discussions and really sitting with caregivers and care providers from around the country. James and I can remember exactly who generated which ideas and which stories of difficulty and obstacle and challenge helped frame which questions. We also were really concerned that this be practical. Nobody wants a strategy with lots of aspirational language that sits on a shelf. This is work that needs to happen, and it needs to be very implementable right away. So as you'll see, we've worked very hard to make sure that that is the case. urgency. We know that caregivers and care providers need support right now. There are things in this strategy that can be picked up and implemented today. So that was very important to us. A broad application. We know how many different kinds of caregiving experiences there are, caregiving stories, caregiving communities. And we know that everybody's story is not the same. We have similar needs, but everybody's story is not the same, and there are different barriers for different people. So it was very important for us to be able to capture all of those needs and frame them that way. And similarly, inclusion. You'll see the nothing about us without us there that comes from the disability rights movement. Really truly informs our work. We're all caregivers. I'm a person with disability who's also received care in my life, and that informs the way I think about this. Quality of life for caregivers, for care providers, for people who access care, for our clinicians, for everybody navigating this broken system with the biggest hearts and the most goodwill. We need to make sure quality of life is at the heart of this work. As James just explained, why we focused on the federal government. And most importantly, this is just the beginning. So this strategy is implementable today. And as James said, there is work to do in all of the provinces, and there is work to do in advocacy to make sure that this strategy is supported, funded, and implemented. So this is not the end of a journey. This is, in many ways, just the beginning. Next slide, Grace. And you can go right on to the next one. So as I mentioned, co-design was very important to us. We wanted to make sure that we valued, heard, and really gave the pen to caregivers and care providers. We also wanted to make sure that we were building a movement in Canada, bringing together sometimes siloed sectors of health and social care, of disability, aging, and healthcare, and really brought everyone together to define some shared goals and to speak in one voice and to speak, to sing from the same songbook, so that as we're advocating for this strategy, our decision makers will hear over and over and over again the same language, the same concerns, and that united front. We kicked off our formal co-design process at the first Canadian National Caregiving Summit, where we spent an afternoon together with a few hundred of you looking at areas of priority and really driven by people's stories and experiences. We had consultations. We had more than 31 consultations across the country, both in person and online. And regionally, we traveled the country, all over the country. It was a very busy year for us. Knowing that people have different capacity to be in person, different capacity to be able to even get away from caregiving duties enough to engage in a process. We had many, many different ways of entering, from an online form to one-on-one teas and conversations to gatherings of hundreds. And all of those ways were ways that we connected with all of you. We also had convened our care champions table of people from leaders from aging, disability, healthcare, and of course, people with lived experience of every kind of care role. And a special shout out to some of those tables, our advisory council, our Canadian Caregivers Advisory Network, made up of caregivers from coast to coast to coast, our care provider fellows, of whom you've heard from one of them today, our Young Caregivers Roundtable, our military and veteran caregiver community, our Working Caregivers Initiative members, and also caregivers with lived experience of particular barriers around health equity and social determinants of health. So we really want to make sure that you know that everything you shared with us went directly into this process. Next slide, please, Grace. And here's some photo evidence. As I said, 31 convenings. We look a little tired in some of these photos because we really did traverse the country. And more than 1,500 of you took the time to fill out a form explaining what you thought would have made a difference in your experience and what you hope will make a difference when your children are caring for you. So we really appreciate that. Next slide, please, Grace. Just a shout out to our care champions table. Again, with leaders from across the country, across geography, across all sorts of disability, disease, healthcare, aging organizations who gave an enormous amount of their time in helping us deep dive into the many ideas that you suggested. Big thank you to that group. Next slide, please. And James, I think I'm going to turn it over to you to start taking us into the strategy itself, the moment you've all been waiting for.
Thank you very much, Liv. So yes, now we'll dive into the more of the details, the meat potatoes of what is actually in the strategy. And for those of you who've heard me do some version of this before, I'm going to try to keep this succinct and brief and focused because there's a lot here and a lot of good stuff, and we'd love to share as much of it as possible as we can. As Don alluded to earlier, we do have 5 pillars to our national caregiving strategy. These have been informed directly by the many, I would say, hundreds of conversations we've had in every part of the country, both online and in person, as Liv said a moment ago. We came into the strategy with one idea of, or strategy development with one idea of a structure, and we came out of it with a different structure, having heard loud and clear around the areas of work that need to be focused on. We'll go through these one by one, starting with, Grace, if you go to the next slide, please. Starting with pillar number 1, improving supports, programs, and services for caregivers. Our work in this regard is divided up into 2 categories. The first around financial supports for caregivers, and the second around caregiver well-being. Starting with financial supports, plain and simple, our first recommendation to government is that they make the Canada Caregiver Credit refundable. This has been a long-standing ask from us here at CCCE. More importantly, this has been a long-standing ask from caregivers from coast to coast to coast, who were given a new lease on life in this regard when the federal government committed to doing this in the 2021 electoral platform of the Liberal Party. And then we saw that reflected in Minister Freeland's mandate letter when she was made Minister of Finance. That commitment remains outstanding to convert it from a non-refundable credit, which does not help too many people, to a refundable tax credit, which would have the effect of putting cash in hand for caregivers who are eligible. As this is an outstanding commitment that theoretically has been costed and studied already, hence appearing in the minister's mandate letter, our number 1 suggestion to government is let's start with that. Have that be the low-hanging fruit, down payment, whatever sort of illusion you'd like, to get things going on this file as the rest of the strategy gets implemented over a longer period of time. We're also suggesting this idea of a caregiver allowance. This is wisdom that we've borrowed from our friends across the pond in the UK, as well as in Australia and New Zealand. And here at home, the provinces of Nova Scotia and Newfoundland and PEI have some version of this, where by virtue of being a caregiver and providing a number of hours of care a week, you receive some cash in your bank account every month. This is a recognition of both the fact that if you're providing that much care to somebody in your life, odds are you're working less than you otherwise would, and consequently, your earnings, your paycheck is lower than it would be if you weren't providing care. So that's one assumption. The other being that you are likely out of pocket quite a bit of money every month as a result of your care responsibilities. The net effect of both of those things is that your pocketbook is being pinched in 1 or 2 ways at the same time. Ergo, there's a job for government to socialize this risk for all of us and provide caregivers with some support with their monthly bills. Similarly, in the same vein of taking this risk out of the home and onto the backs of the rest of us here, is this idea of public care insurance. A number of jurisdictions across the world are looking at this. Some have implemented it. Germany does this, South Korea does this, even Washington State in the United States has a version of this, where you basically create an insurance scheme that allows caregivers and others across society, really everyone, to pay into an insurance scheme. We're suggesting it be funded through social contributions, which is to say a combination of government contribution, employer contribution, and individual contribution off the paycheck. That altogether creates an insurance scheme that lets all of us avail ourselves of care when and if it is needed. Importantly, though, and one way that this is different, the way we're talking about it compared with other jurisdictions, is that for this to work in Canada, we feel it's very important to this be extended to also include disability, and that it not be specifically or only targeted at end-of-life care or senior care, but rather that it also be an option to provide care for folks with disabilities who may need it of various sorts throughout their lives. So public care insurance is a big idea whose time has perhaps come, and we'd like to see this studied in great detail and examined as a way forward. In the second category around improving caregiver well-being, the federal government has gotten quite good at figuring out how to do targeted mental health supports. We've done this for Indigenous communities, we've done this for youth, we've done this for first responders in different ways. Our suggestion here, having heard loud and clear from caregivers around the need for targeted and high quality mental health supports, is that the federal government apply the same logic to our population. That properly funded mental health supports be created that are of sufficient quality and sufficient duration and sufficiently easy to access, then caregivers are able to access them when and if they need it in a prompt and reliable way. The last thing caregivers need is a handoff to another service provider where the phone call might not be returned for a couple of weeks or longer, or handed a business card across the table and say that you should be in touch with them. That's not what we're talking about here. Rather, we're saying, building off the success of other federal programs, create truly accessible mental health supports for caregivers. The second idea here is more general, but we've got these health accords that the federal government negotiates with the provinces on a regular cycle, having heard very clearly through our consultations that respite and home care are very important issues for caregivers that live in the provincial domain. Our suggestion is for the next round of these federal provincial health accords that caregivers be given particular attention with a specific emphasis on respite and home care as services that should be addressed through the next round of negotiations. More on this and the other items you see on your screen later on in the presentation. So next slide, please, Grace. On to Pillar 2, supporting caregivers in work and education. This is meant to help caregivers balance their work responsibilities with their care responsibilities, as well as balance their education needs with their care responsibilities. Far too often, just to dwell on this point for a moment, far too often, young people in particular are put in a situation where they're putting their education on hold or leaving education altogether because of their care responsibilities. This is a very tough position for a young person to be in, where you're essentially mortgaging your future because of your immediate present. And there are public policy solutions that can be brought to bear to this problem to help young caregivers in particular balance their educational needs with the needs to provide care for somebody in their lives. Starting, however, with EI, and this general idea of making leaves and benefits work better for working caregivers. Now, we have the employment insurance system already in place in Canada. Unfortunately, it is not great, to be blunt. It serves fewer and fewer people as the years go on, and fewer workers are covered by it for a variety of different reasons. With the rise of the gig economy, with the rise of part-time work and other less traditional work arrangements, that means that fewer people are attached to the EI system. But it does exist. And for those workers who are covered by EI, which still makes up a healthy proportion of the economy overall, our suggestion is to take the logic that already exists within EI around end-of-life care or risk of death care, where folks are able to put their hands up and avail themselves of these leaves that are designed to help them provide end-of-life or risk of death care for somebody in their lives. Let's tap into that logic and really expand it. Let's expand it up to 50 weeks. So coming up on a year of basically caregiver leave that somebody would be able to avail themselves of through the EI system. Add an additional 6 weeks at the end of it, if necessary, for bereavement, if the person for whom you're providing care passes away. Work with the provinces to align this with various other workplace regulations around the job protected leaves, as distinct from the job protected leaves and benefits, which is what's provided by EI. Make it easier for folks to avail themselves of this by allowing more medical professionals to complete the paperwork. Get rid of this pedantic 1 week waiting period that exists right now while you're waiting for an answer. And as a whole package, let's make it easier to access so that you can jump in and out of your 50 weeks as needed in consultation with your employer, of course, but also that you get your answers back more quickly. With the leaves as they exist right now, we hear far too frequently that people put their hands up to avail themselves of this end of life or risk of death leaves that already exist today. And the person for whom they're providing care ends up passing away before they actually get a response back. That's unacceptable, and better is possible. That's the overall message, is that better is possible. And we'd like the EI system to be able to work better for these caregivers in this new version of care leave. But again, recognizing that a lot of people are not covered by EI, at the same time, we need to think about a solution for workers outside of the EI system. That's where the basket of other things we're talking about today come to bear. Second in this regard is around providing caregivers in work and school with financial security. Our first idea here is around CPP reform. This is one that I've become particularly enamored with, so I will really restrain myself from talking about this at great length. But the Reader's Digest version of this idea is basically that if you are a caregiver who takes time out of the labor market to provide care for somebody in your life, you should not be punished for the rest of your life for providing care because your earnings were very low or nil for those years. Now, when you retire, you go through a process whereby you start to submit paperwork, and you work with the various authorities that govern the Canada Pension Plan, where you go through your years of earnings. For your years of where your earnings have been very low or nil, basically what happens is those years are counted against your overall average. So if they are 0 for, say, 5 years, it is as if for those 5 years you earned nothing, and your overall payments when you actually retire and start to collect your Canada Pension Plan checks are lower than they otherwise would have been had you been working. Now, our suggestion here is that if you are a caregiver, if you are taking time out of the labor market to provide care for somebody else, you are doing all of us a service. You are providing care for somebody you love, and that should not be punished. In fact, that should be rewarded. So rather than be punished for that in perpetuity for the rest of your life through lower CPP payments, our suggestion is you do some accounting in the back end so that when you're lining up to retire, you put your hand up and say, Mr. CPP accountant, for those 5 years, I was a caregiver. Here's the proof. And therefore, if you satisfy that requirement, your average income over the course of your earning life should be applied to those 5 years. The result of which is that when you retire, it is as if you had been working for that time that you were out of the labor market as a caregiver, and your CPP is higher than it otherwise would have been. This is a complex idea with lots of moving pieces to it, vested in all sorts of actuarial and other sciences that are very complicated. But the core idea is simple. You should not be punished for the rest of your life when you retire for having provided care to somebody else. Period. Full stop. And this is how we can fix that problem. In the realm of helping, in particular, younger people balance their education with their care responsibilities, there is a role for the federal government here around the federal component of student loans. If you're taking out a student loan to fund your education, there's a federal component and a provincial component. As this strategy is focused exclusively on the federal component, one thing that the feds can do is allow some flexibility to the federal component of your student loans so that you have longer to repay it. It's easier for you to go in and out of education without having to reapply for student loans all over again. And then if you are providing care and you finish your education, let's stretch the period by which interest is not being counted on the federal component of your student loans. That's the least we can do for younger people in particular who are providing care to somebody while also trying to finish their education. At the same time, we would urge the provinces to do the same because much of this does live within the provincial domain. Now, when you spend some time reading through the strategy, you'll also see in our document a special spotlight on young caregiver assessments. I just want to give a particular shout out to our friend Oliver and the folks that are involved at AMI Quebec and the Young Caregiver Roundtable, who spent a lot of time working on this particular question of young caregiver assessments in their interactions with the medical system. Most of this lives at the provincial order of government because it is in the day-to-day of interactions with the medical system, but it is an important issue that deserves consideration, in part perhaps through those federal provincial health negotiations that I talked about earlier. Moving on to the next slide, please, Grace. Still in the realm of supporting caregivers in work and education, the federal government regulates a large chunk of the economy. Not all of it. Much of it is regulated by the provinces, but whole sectors are regulated by the federal government, particularly those sectors that cross provincial and territorial boundaries. So our suggestion is that for those workers who are in the federally regulated economy, that they be given 5 paid care days, modeled on the similar idea in the UK, and let workers avail themselves of these days in full and half-day increments, again, in consultation pardon me, in consultation with their employers. This has been in place now for a couple of years in the UK, and it is going quite well. And this would also help solve the problem of caregivers tapping into the only days they have available, which are vacation days and sick days, which should be saved for their own needs, rather than having to take a day off out of your out of your vacation days or your sick days to take your mom to an MRI appointment. You should be able to tap into your care days and save your vacation and sick days for when you actually need them. The federal government is also a very large employer across the country. Hundreds of thousands of people work directly for His Majesty's federal government. And the federal government can become a caregiver-friendly workplace, caregiver-friendly employer, through such ways as adding EI leave top-ups and improved access to employee assistance programs. In so doing, they would set the tone for the rest of the economy, as other employers would see the value of being an employer, a caregiver-friendly employer. In that same vein, the other role for the federal government here is to provide incentives. So while they're doing it themselves as an employer and regulating the federally regulated labor market to do this themselves, for the rest of the economy, the feds can provide incentives and tax rebates and recognition programs to help make the case and reward workplaces that do support caregivers with their care needs. Next slide, please, Grace. Thank you. Moving on to supporting recipients of care. Now, caregivers tell us loud and clear that the best thing you can do for a caregiver is support the person for whom they're providing care. And the second best thing you can do is to support the caregiver in their own right. Our contention here at CCCE is that we are a generous, kind, wealthy country. We're a G7 country. Surely it is not beyond the will and ability of man to do both, to support both the caregiver as well as the recipients of care at the same time. So there are a number of things that we can do around supporting folks who receive care in their day-to-day lives, starting with reducing administrative barriers for both care recipients and their families, who often step in as caregivers. First order of business here is around the disability tax credit. If you have ever tried to avail yourself of the disability tax credit or tried to avail yourself of it on somebody's behalf, you know that this is a very difficult project. The paperwork is endless, the reevaluations are ridiculous. The system generally is designed to give you a no and to encourage you to stop at the application stage rather than try to seek out an answer or a re-adjudication. It's time to turn that on its head and recognize that the disability tax credit is both a very important credit in its own right, but also it unlocks a series of other things and can unlock other things. So therefore, let's expand eligibility to a wider definition of disability. Let's get rid of many of the reapplication requirements that exist in many, many cases. Fun fact, I was born missing an arm on my left side. I wear a prosthetic, have my whole life. I receive the disability tax credit every year as a very easy matter of course. My accountant ticks a box. The paperwork has been there for a very long time. It's very simple. I don't even think about it every year. But I have a friend who's missing a leg. Very similar situation from birth. I never have to reapply, or at least to date, I have never been asked to reapply. My friend missing a leg is asked to reapply every 2 or 3 years. Now, that to me makes no sense. That is exactly the sort of thing that we can clear away around waiving these reapplication requirements and just let people go on with their lives once they've got the tax credit. Let's also implement automatic eligibility for other things that can be tied to the DTC, like make the tax credit kick in automatically when children when they age out of the child disability benefit. Get rid of introduce reuse applications and automatic eligibility for the RDSP, the Registered Disability Savings Plan. In that same vein around RDSPs, these are marvelous savings vehicles that have existed for some time, but they haven't really been reformed since they were introduced in the mid-2000s. So it's time to update some of this stuff, starting with auto enrollment, as I just said, tied to disability tax credit, raising the contribution age to 71 from what I believe today, it's standing at around 55, if I remember correctly, reducing the waiting period dramatically, doubling the lifetime contribution limit, and also allowing siblings to hold and open RDSPs for their siblings alongside parents and spouses. This is something that comes up particularly from the sibling caregiver community around wanting to put some money aside for their sibling, but not being able to avail themselves of the same savings vehicle that their parents were able to when they were alive, being the RDSP. So that seems to us like a fairly easy fix. Next slide, please, Grace. Thank you. We need to address the elephant in the room that still is with us in the disability community across Canada, and that's the Canada Disability Benefit. Without spending long on where we are today and various fits and starts on implementation and benefit amounts, I think we can all agree that the Canada Disability Benefit, as we have heard of it so far, is wholly insufficient. So rather than proceed with it as planned, our suggestion is that the Canada Disability Benefit be implemented quickly, but at the minimum of $12,000 a year. And that it be indexed to inflation, and that it be non-taxable. Also, it's very, very important that the Canada Disability Benefit, when implemented, not be clawed back from provincial disability support programs. I cannot underscore this enough. It is absolutely critical that once these funds start flowing into the bank accounts of people with disabilities, they cannot be clawed back out of other forms of support coming from the provinces. That is wholly unfair, and it's robbing Peter to pay Paul. And the net result is that people with disabilities are no better off at the end of all this than they were at the beginning. So that, to us, is a non-starter. Now, around the medical expenses tax credit, this is another one where if you have tried to access it, you know how difficult it is, how mercurial the process appears to be, and how little transparency exists in the system today. So we have a few ideas we're putting out there around reforming the medical expenses tax credit, starting by doubling the credit rate to up to 30%, decreasing the minimum threshold for eligibility so that more people can avail themselves of it, even if their incomes are lower, make the claims process more simple, and also publish the rate schedule so that when you are outlaying for these expenses, whether it be for medical equipment or new wheelchairs or dietary supplements, you have some idea around what you can expect back from the tax credit at the end of the year. Last idea here is increasing the maximum low-income supplement dramatically from under $1,500 up to $5,000, again, to put some targeted support in the pockets of caregivers, particularly lower-income caregivers with a lot of medical expenses out of pocket. Next slide, please, Grace. Thank you. Now on to pillar 4, building a sustainable care provider workforce. I'll remind you, as Liv did earlier, that to us, a care provider is somebody who provides care for a living, like a personal support worker, a direct support professional, a care attendant, and so on and so forth. The variety of different professions that are covered by this category, all of which are undervalued, highly skilled, and underpaid. And beginning with that question of value and pay, our first recommendation is quite simple. Pay care providers better. The federal government made this commitment way back during COVID to have a $25 minimum wage for personal support workers. That has not been fully implemented yet across the country. Some provinces are further ahead than others, but as a kind of standard across the country, this $25 minimum wage for care providers has yet to be introduced. It's time to do that, and it's also time to expand that $25 commitment to other workers in the care economy, like direct support professionals and care attendants. These are difficult jobs who deserve to be rewarded and paid fairly, and this is a good place to start. We also have to think about the pipeline of workers in this space, much of which is coming from abroad. So there are a couple of things we can do here around improving the pathways to permanent residency for folks who are care providers coming from other countries, starting by expanding the federal pilot that exists today, but dramatically, so about doubling it, and then also making it permanent to make it easier and more predictable for people to come from abroad to provide care in our country. We can also reduce processing time to a maximum of 12 months. The way it stands right now, the wait times and processing times vary dramatically from 2 or 3 months to over 3 years. That's unacceptable. Let's set a hard cap that at maximum, it'll take a year for this process to unfold and for you as a care provider to know whether you'll be able to come into Canada and provide care here. It's also time to use the logic of our point system to bring more care providers to Canada as permanent residents. Now, our immigration system is widely recognized around the world as a global leader around how we do allocation of points based on, among other things, skills, education, experience, and language. Unfortunately, the skills that come with being a care provider are dramatically undervalued in the system. We have the system already. Let's use that same logic that gets doctors and lawyers and engineers to Canada. Let's use that same logic to get care providers to Canada to be able to do their good work here. Alongside that is the idea that the work permits that care providers receive when they come to Canada under these programs should be tied not to a specific employer, but rather tied to a sector. So that as a worker coming from abroad to be a care provider, if the work relationship in which you find yourself here sours, you should be able to have the flexibility to quit and find yourself a job within the same sector elsewhere in the care economy. There's a way to do this on the back end through these knock codes. I won't go long into that right now, but you can expand the definitions here so that care providers are able to move around a bit more freely rather than have to go home and restart the process from scratch, which is often what happens right now when a care provider leaves a current employer. Coming up on the end now, Grace, if you go to our next slide. Pillar number 5 is all about government leadership and recognition. This one's fairly simple. We need to make caregiving a priority at the federal order of government, starting by establishing the National Caregiving Strategy and legislation so that it has to exist and be regularly updated on a regular cycle. setting up a standing advisory council to provide good advice around care issues to the whole of government across the whole system, and not relying on ad hoc consultations with stakeholders to try to get at the meat of the issues that are being debated. So these two recommendations go hand in hand. It's also time for the feds to step up and show leadership in the area of care and healthcare in two specific ways. The first is around these federal provincial health accords that I talked about earlier, where for the next round of these health accord negotiations, our suggestion, our strong suggestion, is that caregiving should be top of the list in terms of priorities for the federal government. History has shown that the federal government is able to buy change through these health accords, where they're able to put money on the table in exchange for clear results. This has happened already over a couple of decades around hip replacements, cataract surgeries, mental health, and a variety of different things. It's time to apply that same logic around caregiving to give caregivers the support they need, with a particular emphasis we're suggesting, again, around respite and home care. The federal government also funds national research bodies like the Public Health Agency of Canada, CIHR, SSHRC, and others to do good research at universities and research labs across the country. We've learned from our friends in the States that once these federal research bodies start to take caregiving seriously, the quality of the research goes up, the quantity of the research goes up, and we start to see knowledge mobilization happen more readily, where those results are translated into tactical, changed public policy. So let's do that here. Let's get these federally funded health agencies, research agencies in the health space, I should say, to make caregiving a priority in their work as well. There's one more area that's part of this. And Grace, if you go to the next slide here, please. Thank you. And that's our military and veteran caregiving. Now, serving members of the Canadian Forces and veterans, they need our help. They deserve our help. They put their lives on the line every day. They have volunteered to put themselves in harm's way for all of us and for King and Country. We need more of them, not fewer of them. And if you work in this space, you hear very clearly from both serving members of the Canadian Forces, their families, and from veterans that in order to properly support the soldier, the sailor, the flyer, you need to also support the family. And one of the things that these folks worry about is what's going to happen to them around the care responsibilities that they have as serving members of the forces, but also what happens if they need care and their family is called upon to provide care for them. These are just a few ideas that we're putting out there for early consideration around ensuring that military and veteran families get the support they deserve. Interoperability between Canadian Forces Health Services and provincial healthcare systems, you think this would be a given, but there's a lot of tension points there, a lot of friction points, particularly when folks in the Canadian Forces are transferred from one province to another. They need help and their families need help. It's time for interprovincial mobility of services, starting with eligibility for autism services, particularly for children, automatic case management for families who have more complexity around their relocation needs, and let's take the already existing caregiver benefit and expand eligibility, and so that more people are able to tap into it, and also make access based on individual need rather than the serving member or the veteran putting their hand up and say that it's time and they need that support. Now, we've thrown a lot at you. I'm going to stop going through this now, and I'll turn it back now, I believe, to Donna to help us with the Q&A. Thank you very much, everyone.
Thank you. Thank you so much. I'm just starting my video. There we go. Thank you so much, James and Liv. Oh gosh, that was a lot of information. And I'm sure that we're all kind of reeling from the hope and the complexity and the inspiration of all of this fantastic content. Oh my goodness, what a monumental piece of work for our elected officials. And I just have a few questions that I want to use to kind of bring this back to real life caregiving. And we are going to go to the Q&A, but before we do that, I just have a couple of questions for Jordan and Bhavani. So, Bhavani, over to you first. Based on your experience, how would these policy solutions help you in your role or have helped you?
Yeah, thank you. Thanks, James, for going through all of that. Um, for me, the strategies in Pillar 2 regarding flexible leaves and allowances and things like that resonate to me, as a working woman who chose to leave because of lack of flexible care options. That was this pillar, I think, for me resonated a lot. Over half of women in Canada are caregivers. It's a large number, and the leaves and benefits from a micro place in the workplace, but also macro at a national level with policies and allowances really would help to keep women in the workforce. And with that, it's a larger equation because it helps with productivity, it helps with self identity, but it overall helps to the national economic equation as well. Productivity equals healthy GDP, healthy outputs, and it keeps our economy flowing, stable, and even thriving. So that one really stood out for me. As well with community care and for anyone who keeps their loved one at home or receives services from community care for whatever reason, there's limited hours of service that you get through the day, often 3, perhaps 4. And the care is then supplemented by private paid care. And that obviously is a cost to the family, cost for us as a family caring for my dad. So keeping women in the workforce and caregivers in general in the workforce helps to offset that cost as well. And the caregiver leaves, the allowances, that all helps to cushion that financial blow that a lot of people face. And I have faced that directly. Being out of the workforce means less, deposits into investments, into my retirement funds, into EI, et cetera, et cetera. So that one really stood out for me.
Thank you. It did for me too, as a caregiver who, throughout most of my adult years, I mean, I started working at age 57 when our son got care, but previous to that, I was the caregiver that James described that, uh, the government, I guess, thought I was home eating chocolates or something, but I was doing 24/7 nursing. So there, yes, that pillar was very meaningful to me too. Thank you, Babini. Jordan, how much of a difference do you think a minimum wage of $25 an hour would make to your sector?
Um, so that's hard to say for me. I think it would go a long way. I can't speak for every single care provider and what they would do with the extra income, but I think it's fair to say, just in general, life has become so expensive to the point that I can't see myself affording a home in the future. Um, so for me, I mean that money would mean a lot. And in my job every day, I have to drive all over Halifax in my own vehicle, and just gas alone it's tough. And the thing is, I can't not do it. So I do have to just put that wear and tear on my vehicle because I have to show up for people who live in the rural areas, who live all over Halifax, and that's just the name of the game as it is. So I mean that $25 would be huge. It would change, I think, a lot of people's life for the good. And I mean that's not going to make anybody filthy rich. It's just going to help caregivers who are helping Canadians.
Mhm. Yeah, and stay in the job as opposed to go work in construction or work in a bar or something like that, which is what we see with a lot of my son's caregivers too.
Wow.
It's really rough. Yeah, it's not a living wage, anything below $25.
Yeah.
Would you agree?
No, it's not livable. And that's the thing. It's so easy to just leave because I can make money anywhere else, but I do love the work that I do. I love the job that I have. So I just wish we could make a little bit more, a more livable wage.
Yeah. Yeah. Thank you. Now stay with us, Jordan, because I have another question for both you and Bhavani, but I'll ask you first. What do you want policymakers to know about how to improve the system? If you have one message you would like policymakers to know about that you need them, what is your recommendation, your number one?
Um, I think what I would love policymakers to know is that families who are caring for their loved ones who are seeking professional help, they are struggling to afford, like most of what they are affording is out of pocket. So they're having to pick and choose some days that work for them, some days if they can afford it, but they're rationing the help that they desperately need. So I would love for policymakers to realize that families are struggling. It's not just the caregivers or the care providers, it's the families who are seeking help. They're having a hard time affording the help.
Thank you so much. Bhavni, how would you answer that question? What do you want policymakers to know about how to improve the system?
Yeah, I want policymakers to know that our healthcare landscape is rapidly changing and has significantly changed, especially since 2020, but even before that. So existing policies need to be scrutinized and need a revamp, and new ones need to be created to reflect the existing state of our healthcare, but as well as the future state of the population, given all the data and the stats regarding future trends. Patient care is really enhanced when their caregivers are supported, but healthcare workers as well from all disciplines, all settings benefit from some relief and reprieve when caregivers are also supported. So it's a team-based care approach and solution, relationship focused care that includes supports to caregivers, which overall helps to reduce the burden on the system and the population. And Pillar 5 goes into some of this, but I think it's really important to deep dive into what currently exists and what we need to build for the future.
Thank you both so much. And it just reminds me as well that we're not talking here about something that is, what what I always call like gold jewelry or something. We're talking about very basic, fundamental needs of survival. Yeah, I think it's good to remind ourselves when we're talking about the strategy that this is about um, survival of Canadians and families and the workforce and effectively the infrastructure that keeps our country, um, the proud country that we've come to know. We need this support just to be able to move ahead into the future. Thank you both so much. We're going to move to the Q&A now. And the first question is for James. And the question is, what is the correlation of the CCCE national strategy in its current form that was just released to the Government of Canada national strategy that was actually in the budget last year? So, how are those two versions of a caregiver strategy related, or how do you see this question, James?
Thank you very much for the question. I saw it pop up in from a couple of people, so that's it's a great point. A little bit of history and then a more fulsome answer. So we decided and we started this process around a national conversation around the national caregiving strategy before the federal government made their commitment. So we started back at our summit, really, in November of 2023, where we had that policy lab that Liv mentioned earlier, And then we started to have meetings and focused conversations leading up to the federal budget in April of 2024. April 2024 comes along, the federal government makes the commitment to develop a strategy, and we decided that rather than put our process on hold, we wanted to see it through to the end. Because part of engaging with the federal government on the national caregiving strategy being developed by the feds is and needs to be, what do caregivers actually want to see in that strategy? We had developed this process, we had started these conversations, and our intention here, and I think we've now realized that, is to work with caregivers across the country to develop this, and care providers and researchers and leaders in the sector to develop this document that we can then more or less hand to the feds and say, okay, federal government, as you know, we've been going through this process for some time now. Here it is. We're ready to go. It's time to act on it, time to act on care, time to implement the strategy. The work's basically done.
That's a great answer. Thank you.
Thank you.
So we have time for just, I think, possibly one more question. And it is, can we have this caregiver allowance legislated in a way that the care receiver's income assistance cannot be cut back by the amount of the caregiver allowance? You did allude to this,
Yes.
but can you expand a little bit?
Yes, and this is a very good, more technical question. We certainly agree with that. That these two things need to be evaluated on their own. That the caregiver allowance and the income of the caregiver and the income of the care recipient are three separate and distinct things that need to be considered in their own right. Our suggestion in the policy document is that the caregiver allowance be fully available at the full amount up until $90,000 a year as the caregiver's household income, modeled on the federal child benefit that already exists today. The thinking being that it should not only specifically be targeted to lower income people, it should also be targeted to a wider bunch of people, hinging on the amount of care that you're providing. Because you can be a higher income person providing a lot of care and still feeling that pinch on your pocketbook because of your out-of-pocket expenses and working less than you otherwise would. Now, the other question around these clawbacks and these relationships with other forms of income, this is a lesson we need to heed from the UK. They remain in the midst of frankly, a fairly nasty situation where there's been a whole bunch of undercalculations and overcalculations around the UK care benefit related to the household income and the income of the caregiver. That's resulted in a number of court cases and all sorts of nasty stuff. So this is a design question up front that we think can be addressed with good design that separates out these columns and limits the kind of crosstalk between these different inputs and just keep it straight and simple.
Wow, thank you. Someone did mention that kind of messy stuff that's going on in the UK right now. They mentioned it in the Q&A, so thank you. Very quickly, one last question, James. What timeline do you expect to see, or Liv, what timeline do you expect to see for the changes, for the implementation of and the agreement by the government on this strategy? Are we talking 3 to 5 years? What are we thinking very quickly?
Well, 10 years ago would have been great. Failing without having a time machine, we would say as soon as possible. And we're living in this unique electoral moment that makes for commitments today from government and future commitments from candidates aspiring to government, which is actually the bulk of what Liv will be talking about when we turn to our Act on Care campaign, which is the next phase of this. So I would say as quickly as possible.
I couldn't agree more. That tees us up nicely for where we're going. And I would also say some of that depends on us and how much we can advocate and make it clear that care issues are top of mind when we're voting. Care issues matter to every Canadian family. And we have a way to make it easier for everyone to do that. So let's move now to the campaign that's connected with this strategy. And it is called Act on Care. Here we go.
My son's diagnosis turned caregiving into a full-time job. I was exhausted and isolated. Parenting is a joy. Caregiving is a job. No one should have to fight this hard to care for their loved ones.
For over 10 years, I cared for my dad with Alzheimer's. As an only child, I took on everything, but at a great cost. The system doesn't make it easy. Caregivers like me are often forgotten. We overcommit, neglect our own needs, and face burnout.
When my mom was diagnosed with dementia, I was a university student with no support. I juggled caregiving and studies, feeling lost. Now, as someone who supports caregivers, I still face the same struggles.
I ignored my own well-being for years while meeting my son's needs. There was a lot of weight on me. Families like mine cannot go on without better support.
I work 24/7 as a live-in care provider, managing every detail of my client's life. I love what I do, but I struggle financially, and my status as a new Canadian remains uncertain. Caring for seniors should be respected and valued.
More than 8 million Canadians give their all as caregivers, yet they're left with little support. Now, thousands of Canadians have united to design a new national caregiving strategy. A united call for change, ensuring caregivers get the acknowledgement and support they deserve. Financial relief, workplace support, better access to benefits, respect for paid care providers, federal leadership. Support for Canada's caregivers can no longer wait. It's time to act on care. Add your voice to make caregiving a national priority.
Oh, Liv, you're muted.
Yeah,
Unmuted.
there you go.
There we go. Has to happen once a webinar. We hope you saw some familiar faces in that video. There are caregivers and care providers from across the country who stepped up to share their stories and their voices for this campaign. And we would love for each of you to take out your phone right now and go to canadiancaregiving.org/act. And what you'll find there is a very easy one-click form that will send your support for the strategy to your local MP, your federal candidates in your riding, the Minister of Seniors, and who is responsible for the National Caregiving Strategy, and all of the party leaders from all of the federal parties. James is showing you what it looks like. It's very easy to do. We would love for you to do it, to get your friends to do it, to get everyone you know to do it. The way we're going to really put this on the radar is, yes, by having well-crafted and implementable strategy, and by advocating. And that is where all of you come in, all of you who stepped up to share your stories, to help us understand all the ways in which the system isn't working. We're tapping on your shoulder again to say, please stand with us and get in touch with your elected officials. Get in touch with the people who come to your door to tell you they want your vote, and make sure people understand that care is important to you and that this is a top issue for you moving forward. This campaign will be going out in many forms, including an ad in the Globe and Mail and the National Post that you may have seen. That was a full-page ad with more than 50 endorsing organizations from everyone from the Canadian Cancer Society, Alzheimer's Canada, March of Dimes, spanning aging, disability, and disease or healthcare groups. You can also take a deep dive into the strategy. Isn't she pretty? The strategy is available also at that same website, and as are lots of ideas about how you can get involved. We want this to be empowering and straightforward for people. And Grace, if you move to the next slide. We know that we didn't get to everyone's questions. We have an open door policy. Please email us if you have questions, if you want to get further involved in the campaign. If you want to join any of the groups that we mentioned that advocate on a regular basis, like our Caregivers Can Network, our Young Caregivers Roundtable, our Working Caregivers Initiative, and on and on and on it goes. This is, as we said, just the beginning. This is work that we are committed to seeing through. We want to see change for caregivers, as James said yesterday, but also we want to see change immediately and a longer term real structural change, both at the same time. So we can't thank you enough. I want to thank Donna. I want to thank James, who put his heart and soul into this work, along with our whole team. Grace, whose name you've heard multiple times on the back end, our whole staff team, and Bhavani and Jordan, who shared their stories with you today and have shared them with us in crafting this strategy. And thank you to all of you who took time to contribute to this strategy, and we know you'll help us push this over the goal line now. So thank you, everyone. Thank you for joining us today.
Thank you so much.